there had been a big shift away from what was previously referred to as Digital Health 1.0, which was the attempt to sell products and services around healthcare to patients. And it largely failed because patients don't pay for their own healthcare typically, and they weren't going to pay out of pocket for additional services that they didn't feel they needed and that didn't integrate with their typical care pathways. The second wave of digital healthcare, which is what I started getting involved with back when I joined Techstars in late 2015, was Digital Health 2.0, which was really focused on providers and payers. Providing technologies that acknowledged that you're not going to disrupt the electronic medical record. Like Epic and Cerner and Allscripts are not going anywhere. So you're going to need to figure out how to play in the work streams that physicians are already using and using the products that they're already using, and acknowledge that you're not going to disrupt the $3 trillion industry overnight, which was, I think, an arrogance that a lot of entrepreneurs coming into digital health had. And the companies that I found myself working with were very pragmatic around needing the support of the health system, which can normally take 12 to 18 months to get. The reality is that health systems are incredibly risk averse. Putting a new technology in that might affect a patient's outcome or even the efficiency of a clinician is not a risk that most providers want to take. And so finding entrepreneurs that can weather that storm, work collaboratively with the providers over a long period of time, that's a patient approach, not patient as in healthcare patient, but as in requiring time, that a lot of entrepreneurs didn't have from that first wave, but I think has become the norm for healthcare 2.0. I don't know what healthcare 3.0 is going to be. I do think with some of these emergent products and services like the Apple Watch, like the Oura Ring, and sensors and smart homes, that maybe there is an opportunity to get back into the home, back into the patient's wallet. I think as younger patients are starting to age and they're a little bit more tech experienced, there's some more tolerance to that. But I still think you can't ignore the way that healthcare is paid for and provided for in this country. And it is a complex system that involves your employer, it involves insurers, it involves providers who are still going to be resistant to putting in some new technology. And hopefully it'll involve a lot more government grants and support as well.